It is 2 in the morning and the house is completely quiet, and then you hear it from the corner of the bedroom. Slurp, slurp, slurp. You already know what it is before you even open your eyes. Your dog is at their paws again, chewing and licking with that focused, relentless intensity that tells you this is not casual grooming. This is something that is driving them genuinely crazy. You tell them to stop. They pause for about 4 seconds, look at you, and then go right back to it the moment you close your eyes. If this is happening in your house right now, I want you to know something important before we go any further. You are not alone, and this is not simply a quirk or a bad habit your dog has developed. Paw licking at this level of intensity is almost always telling you something specific about what is happening inside your dog's body. And the frustrating part for so many owners is that they have already spent significant money trying to fix it through vet visits, allergy medications, steroid creams, medicated shampoos, and cone of shame after cone of shame, and the licking keeps coming back. Today we are going to talk about why that happens, what is actually going on underneath those paws, and what a genuinely thorough approach to addressing it looks like. By the end of this video, you will have a clear, honest picture of the most common causes, the supportive measures worth trying at home, and exactly when the situation calls for a proper veterinary workup rather than a home remedy. Hi everyone, I am Dr. Stephen Clarke, and welcome back to the channel. Paw licking is one of the most common things owners ask me about, and it is also one of the most frequently mismanaged, not because vets are doing anything wrong, but because paw licking has multiple possible causes that can look identical from the outside, and treating the wrong cause obviously does not produce results. So today, we are going to go through this properly. Grab a notebook if you want to take notes. Let's get into it. The very first thing I want to establish is that not all paw licking is the same, and the difference matters enormously when it comes to figuring out what is actually going on. Occasional brief paw licking after a walk or after meals is completely normal grooming behavior in dogs. It is not a concern. What we are talking about today is chronic, repetitive, intense paw licking that happens throughout the day and night, that leaves the fur between the toes stained a rusty, reddish-brown color that causes visible redness or irritation on the skin between the pads, and that your dog seems unable to stop even when you redirect them. That level of licking is a symptom, and it is pointing at an underlying issue that needs to be identified and addressed rather than just suppressed. Let me walk you through the most common underlying causes, because this is where most owners, and honestly sometimes even vets who are moving quickly through appointments, can make the mistake of assuming the cause without fully investigating. The first and most common category is skin-related issues, which includes yeast overgrowth, bacterial skin infections, and contact dermatitis from environmental irritants. The second category is true allergic disease, which can be environmental, meaning reactions to pollen, dust mites, or mold, or food-related, meaning a sensitivity to a specific protein or ingredient in the diet. The third category is parasites, including fleas, mites, and in some geographic areas, certain types of hookworm larvae that can penetrate the skin of the paw pads. The fourth category is pain, including arthritis in the joints of the foot or lower leg, nail bed problems, or foreign bodies like grass seeds embedded between the toes. The fifth category is behavioral, including anxiety-driven repetitive behaviors that can develop or worsen in dogs who are understimulated, stressed, or anxious. The reason this list matters is that each of these causes has a different primary treatment, and putting a dog on a long-term allergy medication when the real issue is a yeast infection, a grass seed, or an anxiety disorder is not going to produce lasting results. The medication might reduce some of the inflammation and dampen the itch signal temporarily, but the underlying driver keeps running in the background. Let me tell you about the smell test, because this is genuinely one of the most useful, quick assessments you can do at home. Pick up your dog's paw, spread the toes gently, and smell the skin between the pads. Healthy paw skin should not have a strong or unusual odor. If what you notice is a distinctly yeasty, slightly musty, corn chip-like smell, that is a significant clue. That specific odor is produced by the metabolic byproducts of Malassezia pachydermatis, which is the species of yeast most commonly associated with skin infections in dogs. Malassezia is a normal resident of dog skin in small numbers. But when conditions favor its overgrowth, it colonizes warm, moist, enclosed spaces like the skin between the toes very effectively. It causes intense itching and irritation, and the licking response to that irritation unfortunately creates more warmth and moisture, which feeds the yeast further. This is the cycle that makes yeast-related paw licking so persistent and so difficult to break without addressing both the symptom and the underlying overgrowth simultaneously. The rusty brownish staining on the fur between the toes that you see in chronic cases is caused by porphyrins in the saliva, oxidizing on the hair shaft, exactly the same process that causes tear staining under the eyes in light-colored dogs. Now, why does yeast overgrowth happen in the first place? This is where diet and gut health genuinely do come into the picture, though I want to frame it accurately. Yeast is an opportunistic organism. It takes advantage of conditions that favor its growth. Several factors can contribute to those conditions developing. One is a diet that is very high in refined carbohydrates, since carbohydrates break down into glucose, and glucose is a fuel source for yeast. Many commercial dry kibbles, including ones marketed as premium, contain significant quantities of starchy carbohydrates like corn, wheat, rice, potato, or peas as binding agents necessary for the manufacturing process. This does not mean kibble is bad, or that every dog-fed kibble will develop a yeast problem, because most do not. But in dogs who are already prone to yeast issues, a high carbohydrate diet can be a contributing factor worth addressing as part of the overall management approach. Another contributing factor is a disrupted gut microbiome, since the population of beneficial bacteria in the digestive tract plays a role in keeping opportunistic organisms like yeast in check. Things that can disrupt the gut microbiome include repeated antibiotic courses, a diet low in fiber and variety, and chronic stress. A third contributing factor is anything that suppresses the immune system's ability to keep skin organisms balanced, including long-term steroid use. This is actually one of the reasons that chronic steroid treatment for paw licking can sometimes make yeast overgrowth worse over time, since steroids reduce the immune response that would normally keep Malassezia populations under control. So what can you do about suspected yeast overgrowth at home while you are working with your vet on a diagnosis? Let me walk you through the supportive measures that are reasonable and low risk, with realistic expectations about what they can and cannot achieve. The first and most immediately practical thing is a topical soak designed to alter the pH environment on the paw skin. Yeast does not tolerate an acidic environment well, and diluted apple cider vinegar creates an acidic surface that is inhospitable to Malassezia. Here is how to do this safely. Mix 1 part raw unfiltered apple cider vinegar with 2 parts warm water in a container large enough for your dog to stand with their paws submerged. If the skin between your dog's toes is visibly raw, broken, or bleeding, do not do this soak, since the acidity will cause significant stinging on open tissue. In that case, wait until the skin is healed enough to be intact before using vinegar. For intact but red, itchy, smelly paw skin, have your dog stand in the mixture for about 5 minutes, making sure the solution reaches between the toes. After the soak, dry the paws very thoroughly with a towel, paying particular attention to the spaces between the toes. This step is critical because yeast thrives in moisture, so leaving the paws damp after a soak is counterproductive. If your dog tolerates it, a hairdryer on the coolest setting held at a safe distance can help ensure the interdigital spaces are fully dry. Do this once daily and evaluate over a week to 10 days. The corn chip odor typically improves noticeably within a few days if yeast is the primary issue, and the redness and licking should begin to calm down as the yeast population is disrupted. Alongside the soak, keeping the paws as clean and dry as possible throughout the day makes a meaningful difference. Wipe your dog's paws with a damp cloth after every outdoor walk to remove grass, pollen, soil, and any environmental irritants that may be contributing to the irritation. Dry them thoroughly after wiping. If your dog walks on treated grass or sidewalks that have been salted or chemically treated, rinsing the paws with plain water after every outing and drying them completely is one of the most effective things you can do to reduce contact irritation. It is simple, it costs nothing, and it removes a potential driver of the licking that has nothing to do with internal health. From a dietary standpoint, If you have a dog with chronic recurring yeast-related paw issues, and you are currently feeding a diet where the first several ingredients are starchy carbohydrates, it is worth having a conversation with your vet about whether a dietary adjustment makes sense for your dog specifically. Transitioning toward a food with a higher proportion of quality animal protein and a lower overall carbohydrate content removes some of the dietary fuel that supports yeast overgrowth. This is not a rapid fix, and it takes several weeks to begin showing an effect internally, but it is a reasonable long-term management strategy in dogs where diet appears to be a contributing factor. If you make a dietary transition, do it gradually over 10 to 14 days by mixing increasing proportions of the new food with the old to avoid digestive upset. Adding a good quality canine probiotic to your dog's daily routine is another reasonable supporting measure, particularly in dogs who have been through multiple courses of antibiotics or who have chronically unbalanced gut bacteria. Probiotics introduce beneficial bacterial strains that compete with opportunistic organisms in the gut and support a more balanced microbiome. Look for a product specifically formulated for dogs that lists multiple bacterial strains and a meaningful colony-forming unit count. Plain unsweetened yogurt with no xylitol or artificial sweeteners is a gentler, food-based way to introduce some beneficial bacteria as a starting point. As always, check every yogurt label for xylitol or birch sugar before it goes anywhere near your dog, since even small amounts are toxic to dogs. Now I need to talk about something really important, which is when home measures are not enough and a proper veterinary investigation is necessary. If you have done the paw soaks consistently for 2 weeks, you have cleaned and dried the paws after every walk, you have improved the diet, and you are seeing no meaningful improvement in the licking or the paw condition, please book a vet appointment rather than continuing to try different home remedies. Persistent paw licking that does not respond to the measures I have described could mean several things. It could mean the issue is bacterial rather than yeast, which requires a different treatment approach entirely. It could mean there is a foreign body like a grass seed or thorn embedded between the toes, which can be extremely difficult to spot with the naked eye, but causes relentless, localized licking. It could mean there is a true allergic disease, either environmental or food-related, that needs proper allergy testing and targeted management. It could mean there is a nail bed infection or a cyst forming between the toes, which are both conditions that need veterinary treatment. Or it could mean there is a pain component driving the licking, including early arthritis in the small joints of the foot that is not yet visible from the outside. A vet doing a proper examination of the paw, possibly including a cytology swab to look at what organisms are present under a microscope, and possibly skin scraping to check for mites, can give you a definitive answer about what is actually happening rather than leaving you guessing. I also want to spend a moment on the behavioral component of paw licking because it is genuinely under-recognized. In some dogs, particularly those who are anxious, easily stressed, or who do not receive adequate mental and physical stimulation, repetitive licking can develop into a compulsive behavior that has a self-soothing function. Licking releases endorphins in dogs, and a dog who discovers that paw licking feels calming during a stressful moment can gradually develop a habit that persists even after the original physical trigger has resolved. This is more common than most owners realize, and it can coexist with a physical cause, meaning a dog can start licking because of a yeast infection and then continue licking long after the yeast has cleared because the behavioral pattern has become ingrained. If your vet has ruled out or treated the physical causes and the licking continues at the same intensity, a behavioral consultation or discussion about anxiety management may be the appropriate next step. Let me also mention environmental allergies specifically, since this is often the first thing that gets blamed for paw licking, and sometimes it actually is the correct diagnosis, though it is frequently assumed without proper testing. Environmental allergic disease in dogs, which vets call atopic dermatitis, involves an overactive immune response to environmental proteins like pollen, dust mites, mold spores, and grass proteins. It tends to cause seasonal flare-ups that coincide with specific pollen seasons, though in dogs with severe disease it can become year-round. The paws are one of the most commonly affected sites, because they come into direct contact with outdoor allergens on every walk. Atopic dermatitis is a real and significant condition that does sometimes need prescription immunosuppressant medications like those your vet may have suggested, and in appropriate cases, those medications are genuinely the right tool. They are not always just a band-aid, and I want to be fair about that. For a dog with genuine moderate to severe atopic dermatitis, appropriate medical management can be genuinely life-changing in terms of comfort and quality of life. The issue arises when that same medication is prescribed without investigating whether something else might be the real driver. Asking your vet whether a skin cytology or an allergy workup would be appropriate for your dog before committing to long-term medication is a completely reasonable and sensible question. Let me now pull this together into a practical plan. If your dog is currently licking their paws intensely, here is a rational, stepwise approach. Start tonight by picking up and smelling the paws. Note whether there is a yeasty or corn chip odor, visible redness between the toes, or rusty brown fur staining. These clues help you understand what category you are most likely dealing with. If the skin is intact and the yeast smell is present, begin the diluted apple cider vinegar, soaks once daily, and commit to thorough drying after every soak and every outdoor walk. Review the diet and consider whether a transition to a lower carbohydrate option is feasible and appropriate for your dog. Add a canine probiotic to the daily routine. Continue these measures consistently for 2 weeks. If you see clear improvement, continue the routine and monitor closely. If you see no meaningful improvement after 2 weeks of consistent effort, or if the skin condition worsens at any point, book a veterinary appointment rather than continuing to try different home approaches. If you see swelling, discharge, bleeding, or your dog is in obvious pain around the paws, book that appointment immediately rather than waiting 2 weeks. One final thing I want to say before we close is about the emotional side of this, because I know it genuinely is emotionally exhausting to watch your dog be uncomfortable night after night and feel like nothing you are trying is working. The two things that drain owners the most are spending money on solutions that do not address the right cause, and not having enough information to know when something is beyond the scope of what can be managed at home. I hope this video has given you both a clearer picture of what the likely causes are, and a more informed sense of when to try supportive measures at home versus when to push for a proper veterinary investigation. Your instincts about your own dog matter enormously. If something feels like more than a minor irritation, trust that feeling and get it checked. If this video gave you clarity on something you have been struggling to understand, please hit the like button. It genuinely helps this kind of detailed content reach more owners who are dealing with the same frustration. Subscribe so you do not miss the next video, and leave me a comment below. Does your dog have chronic paw licking, and have you figured out what was actually causing it? I read as many comments as I possibly can, and I love hearing the real stories from your experiences with your dogs. Give your pup a gentle scratch behind the ears from me. Take care of those paws tonight, and I will see you in the next one.